Well, good morning, everybody. Thanks for joining us. Today, we're going to be talking with Chris Novak here. He's going to walk us through Allstate, which is now actually nationwide as of today. They're now under the nationwide umbrella instead of Allstate. So he's going to walk us through going through group insurance, basically the step-by-step guide on what we need and how we can do it, and then just kind of show you exactly how to present it to your clients and get your group sales in. So without further ado, Chris, I'm going to hand it over to you.
I appreciate it. Thank you. Thank you, everybody, for being here today. This is not going to be, I'm not going to take a ton of your time. I hope to give a little bit of time back to you today, mainly because, you know, I'm going to touch on kind of the basic insurance, getting out in front of your employers and introduce how to be comfortable introducing this and kind of knowing a little bit of the ins and outs of just how to get in front of an employer and what's right and what's wrong within the presentation space, if that makes sense. If it doesn't, try to make it that way shortly. Actually, before I get going here, I'm going to take you back to this page because this is the first time I'm doing it with, we're still getting the insignia and all that stuff, but and you'll see a little bit of a back and forth between the words nationwide now and Allstate. So we just were, as of 7/1 today, we have officially been sold and have begun working under the umbrella of nationwide, no longer Allstate. As you can tell here, there's no difference in what I do on a day-to-day basis or product works or anything to that effect. So really all that's happening here is instead of using the words all, we are now using nationwide. Now you will still see Allstate names on quotes and things of that nature, probably until early first quarter next year. And that's just a transition process, but wanted to give you all a heads up about that in the first place. And Eli Manning is, not Eli, excuse me, Peyton Manning, who is the face of Allstate. Excuse me, nationwide. I gotta get used to this myself, obviously. Has some of those. He's already doing commercials for us, allegedly. So hang tight with me here. I want to get through this here, see how many times I say Allstate versus nationwide, and I apologize, but please know that right now those terms are interchangeable with this product. All right, so what we're talking about here is a level funded product. This is for groups of 2 enrolling employees and greater. I personally work in the 2 to 50 enrolling employee space. I do have a colleague that works in the 51 plus space. If you have any of those opportunities, and that's number of enrolling employees, not business, for example. Level funded products are very cool because we have the ability to underwrite, and it might sound like a little bit of a when you look back at health insurance, especially nowadays, you have the fully insured plan where there's no health underwriting. Everyone just kind of picks the plan and you move on. Why health underwriting is important is because we can offer groups much better rates and even better plans because of that too. So within that, we actually have the ability to show the employees and employers transparency, show them what the actual cost is and where that cost is actually going on a month-to-month basis, instead of just writing one check out to the insurance company and having that insurance company wherever it goes, it goes. So we're going to show you where that money goes and how the employer has the chance of getting some of that money back. We are very, very nimble. We have over 10,000 planned options that we can offer. That's also something that's very different from the fully insured or the metallic plan space. Right now you have those gold, silver, bronze, platinum plans. All of those plans they're very stagnant. They are what they are, and there's usually about 20, maybe 30 of them if you're lucky. With our plans, we have the ability to really toggle between lots of different options for things such as deductible, co-insurance, co-pays, different networks, different out-of-pocket maximums, things of that nature. Lots of different options that we get to choose from, which allows you to be very consultative with the employers that you're working with. You're creating an opportunity for them to be able to go out there and actually create a plan for their employees versus just saying, here's the cookie cutter that everybody else can have too. I just mentioned a little bit earlier, there's a refund opportunity within this product as well, and that has to do with the fact that, again, we're able to underwrite and set money aside to self-fund. If that money isn't utilized, the employer gets some of that money back. And there's no additional risk to the employer or employees. So when you hear the word self-funded or level funded, that can be kind of scary for a small business owner. And the reason it's scary is because if somebody gets cancer and there's $1 million in treatment, no employer, especially a small business employer, wants to spend $1 million for claims. They may not have it. They might go bankrupt if that's the case. And so what we do here is we put everything into one nice, neat package to where the employer and employees are due only their monthly premium, and that's the extent of their liability. As I touched on already, we're very flexible and customizable in terms of our plan designs, but it doesn't lead, or it's not just the plan designs themselves that are customizable. We can also customize who is considered eligible for a plan. We have the ability to do carve-outs. We have the ability to offer this product to 1099 employees. We can do a W-2 1099 mix. So from that standpoint, we're very nimble in that regard. And it gives us the ability to get groups that a lot of other carriers are not willing to put their neck out on the line for. We will. 1099s are a big one, where a lot of other carriers don't want 1099s, or has to be a very small percentage of the group in order for that to be okay. We'll do a group purely of 1099s. We'll do a group of, again, W-2 and 1099 mixes. We can do carve-outs, meaning if, let's just say we're at a restaurant and most of the wait staff and kitchen staff aren't making enough money to purchase health insurance on their own here through the group health plan, we can carve those people out altogether and offer it only to the management. That's something that I do a lot of times with restaurants because of that same scenario right there. We can carve it out based on hourly versus salaried. Or if there's one location in Wisconsin, one location in Iowa, we can carve out only those that are in Wisconsin into the plan and those that are in Iowa out of the plan, and they can get a different plan for those folks. There are no industry restrictions. So for example, if you want to offer this to a, let's call it a bar, we can do it to a bar, we can do it to a church, we can do it for a city, we can do it for an oil changing platform. So you name it, the industry, there's no restrictions there. There are a few states that have state restrictions for this product. There's only a handful of states that have that, and I can explain those to you. Generally speaking, they're public entities, meaning cities or counties, police departments, things of that nature, that we wouldn't be able to do it for. And we can go over those when those opportunities come about, or if you have a question about those directly, that we can take offline. We're also very flexible in participation. We require only 50% of all eligible employees to participate. If not, we do allow 75% after valid waivers. So an example of that would be if we have 10 enrolling employees and only 3 want to enroll, obviously we don't have 50%, but we can have 75% after valid waivers. Valid waivers meaning that we remove those people that have coverage, credible coverage elsewhere. If you have 75% with credible coverage elsewhere, 25% of the other folks with credible coverage elsewhere, we are able to do that and get that group rolling here for you as well. We like to take a consultative approach, and I think I've already touched a little bit on that, with the ability to create plan and be nimble with plan designs and doing things such as carve-outs or offering it to groups like 1099s and W-2 mixes and so on. we can take that consultative approach with a business, and that is a huge, huge win. Just because you're bringing something to the table a lot of times that other folks don't know that is available. These level funded plans are getting more and more and more out there with the competition right now. It's becoming kind of the new way of group health business, is underwriting with a level funded product. Again, because underwriting is a good thing and insurance companies like the ability to underwrite. If there are ever any questions, or if you need me available to help present, I am here to help do that with you. That is my job here, to jump on a phone call with you and help sell. When you win, I win as well. I'm also a commissioned employee. So whenever you need me to jump on a phone call with an employer, after we get the group underwritten and it's time to sell the thing, I'm happy to jump on there, walk through the options, and make those consultative suggestions, especially after we know what the health of the group is. For example, if nobody's taking any medications, nobody has any health conditions, we probably want to go with a higher deductible plan because no one's using it. So let's not overpay for something we're not using. However, on the swing side, we might have a group that has, everybody's taking 1 or 2 medications for things like blood pressure, cholesterol, things of that nature. And if that's the case, fine, so be it. We probably want to put them on a copay plan, and maybe with a lower deductible because they might be seeing the doctors more often or going to the hospital more often. So that's the type of approach that we want to take. And I'm going to be here to help you every step of the way on that and walk you through that. I am here for the implementation process as well. So once that group says, yeah, let's do it, we'll get the employer paperwork in their hands. They'll get that over to me or to you, and you get that over to me, and we'll get that thing processed through here on our end. We're very quick with our turnaround during the implementation process. Once we get it over to our third party allied to implement, it usually takes 3 to 5 business days. Outside of fourth quarter, 3 to 5 business days. Inside fourth quarter, that can be more like 5 to 10 business days, just because everybody and their mama wants the group health insurance January 1st. All right, so we talked about underwriting a few times already. One key thing that we do also have, take a look at these states right here. We do have the ability to underwrite groups a little bit larger, 20 to 50 enrolled employees with a renewal and a census. And that's it. And then obviously their census, there's actually one other document that the employer would need to complete. But we do have the ability to underwrite a group without the individual questionnaires. And it is a truly very simple process. If you have any opportunities like this, please give me a call. I want to make sure that we go through the process of this a little bit more in detail, because while it is called simplified underwriting or keeping it simple, we do want to qualify the group and make sure that they are a good fit and understand kind of the process of this. It actually can take longer than having individual applications completed for each employee. That is the other, I didn't touch on this, but when we are underwriting, there is a 5-page employee application that the employees do need to complete to get underwritten. That 5-page application is very simple stuff. The whole first page is just basic information about the employee, where they live, what their address is. I guess that'd be the same thing. Sorry for the redundancy there. Social, phone number, and things of that nature. Very simple stuff. Once that's complete, we get that over to our underwriters. If our underwriters have any follow-up questions in terms of, hey, these are the health conditions that are on the plan, but they didn't give us any details as to what medications they're taking or anything to that effect, we will come back with some follow-up questions just to get those cleared up, and then have a firm and final rate. And that determines what this quote looks like. Now, this is a pretty big group that we're looking at. This is, I want to say, like, I should be able to tell the next one. Nope, I can't. I want to say there was about 30 to 35 enrolling employees on this group when we were recording it. And that might be a little bit off, but either way, this is what our quote looks like. Very simple stuff. I don't know if you're able to see my mouse, but if you are, starting up here at the top, we have your deductible, in network and out of network, the family deductible is directly below. So 1,500 for an individual times 2 for the family at 3,000. Each individual is responsible for only $1,500. So up to 2 people. So if you have a family of 4, if 2 people hit their deductible of $1,500, that'll satisfy the $3,000. And then the whole family will accumulate towards the out-of-pocket maximum following that. Okay, so you have your deductible, your co-insurance, out-of-pocket maximums, very simple stuff. A lot of people like to get, I think they kind of force themselves into thinking this is a very confusing page. And the fact of the matter is, especially for groups that have group health insurance in place already, this is nothing new. A lot of people like to think that group health insurance is something that it's a prestigious product and it can psych people out. I promise you, it is a very simple product to sell. There are a lot of different moving parts to it, but after you go through it 1 or 2 times, just like you did when you were selling whatever other products you're selling right now, you get the hang of it really quickly, and it's actually very easy to explain and to go through. You have your out-of-pocket maximum, you have your copays, PCP, primary care physician, and specialist copays. We have telemedicine. It's no longer Viore Health, but we'll talk about that here in a little bit. I'm sorry, Viore is part of our product, and it is Recuro. Okay, so I did update this more recently. Urgent care visits are also part of that, and then we have a medical network, Cigna Local Plus in this case's scenario, and then at the very bottom, the total monthly premium. A couple different plans to look at, and the group gets to make a choice what they'd like to do there. This page right here, though, which is on those quotes as well, is what makes this group product a level-funded or self-funded product. And this is where you don't really even have to get into the details with the employers, because really, at the end of the day, this is the extent of their liability, the 313.22. The 3 lines above it are monthly premium, and this is where we're being transparent and where that money goes to. Stop loss premium comes to Nationwide. Nationwide is the stop loss carrier. We cover everything in excess of the stop loss points, and I'll talk more about those in a moment. Admin, sales, general expenses, commissions, things of that nature, and then most importantly, admin, our third-party administrator, who handles the claims, the customer service, and such. That is, they're going to take on the this bucket right here, and that's where that money is going to go to. And then last but not least, claims account. So $41.93. If you multiply that by 12, you're going to get $50,322.24. And that is this annual aggregate attachment point. This is the self-funded bank account. So as you can tell, or as I just mentioned, this money right here, the $4,193, it goes into that annual aggregate attachment point. It is what self-funds this product. It's part of the monthly premium already. We're not asking for this $50,000 up front. We're not asking for the $50,000 if someone has a really bad claim early in the year. That we're expecting that money to be there over the course of the entire 12 months. Okay. So if this $50,000 gets utilized for claims and customer service and such, what's going to end up happening there is once that $50,000 is exhausted, Allstate, who is being paid the stop loss premium right here, we cover everything in excess of that $50,000. Okay, so somebody has a $1 million claim, no problem. The employee is going to be responsible for their $2,500 out-of-pocket maximum. We're going to pay, most any one person can utilize out of this bucket is $40,000. So that one individual, we're going to pay $40,000 to that $1 million claim, and then another 90,000 or 900. What is it? We'll just call it $1,000 roughly. Nationwide is covering of that claim for the group. Nothing more. The employer is not responsible for anything more. The employee is not responsible for anything more. That claim is covered by us. Okay. If on a swing side, let's just say we don't have those $1 million claims, but rather nobody has any claims. At the end of the year, this bucket right here, this 50,322, whatever is remaining in that bucket. So people are going to utilize it in some fashion just for physicals or wellness visits, things of that nature. So let's just pretend about $5,000 gets utilized out of that. We have $45,000 left over. Well, the employer at the end of the year is going to get half of whatever is remaining back in that bucket. So they're going to get $22,500 back in the form of a refund check, which would, in this case, in this scenario, it would actually cover 1 month of premium. Pretty cool stuff there. Pretty cool. All right, so Recuro Health. Virtual, we have recently added Recuro Health. At one point in time, we had Walmart telehealth, and that was great. Recuro Health, though, on the other side, is significantly better. And the reason being is because there were limits to the Walmart, whereas Recuro Health, it is unlimited usage. So if you want to call Recuro Health on a daily basis, you are welcome to do so. You can do your virtual urgent care visits there every single day for minor illnesses and injuries. Doctors there will be able to provide prescriptions to your local pharmacy. And this has been a great godsend. On the below part here, the virtual behavioral care will actually allow you to go see a therapist on this as well. If you have a copay plan, it is a $0 deductible or copay for using Recuro Health. And you can use this for ages 10 and older that are on the plan. Papa Caregivers is it's essentially like a respite type care, a service that we provide 10 free hours to all employees, not all lives on the plan. For each employee that's enrolled on the plan, we'll provide them 10 hours of Papa Caregivers. So an example of that would be if you had to go have a knee surgery and you have a dog that is extremely wild, one of those breeds that is not a tame dog, needs to be walked every single day, probably multiple times a day. Well, if you have your knee surgery and you can't take your dog for a walk, you can call Papa. They will come to your house. They will walk your dog for you, and they'll bring them back, and they'll do it again the next day until you either use up your 10 hours or until you're done. So it's pretty cool. That is something that I highly, highly recommend utilizing if you ever have any needs. They can come watch your kids too. If you had to run out of let's just say you had to run out of the town for a business meeting and your babysitter couldn't be there, you can call Papa. They can get one there for you and take care of your kids for you that day. Compass Connect, more to come on that. This is going to be something that we call reference-based pricing, or we call core value in-house. It is essentially a cost steerage tool. Helps keep low cost, but it's for reference-based pricing plans only, not for our network plans. And the vast majority of the time when we're looking at quotes, that is not going to be considered. This is not part of the plan if it is part of a normal network versus the reference-based pricing. Touched on the Recuro, just another slide here just to double down on the fact that if you have a copay plan, it's $0. If you have an HSA, it's $38. On the back end, once the group is implemented, you do have a broker portal that you can go in there. You can hit terminate folks. You can add folks, add new babies, things of that nature, change addresses, view rates and such. All of that is available on right now it's the Allstate Benefits portal. I assume that that's going to be changing its allegiance to the Nationwide portal. To be determined on that as to how that's going to look and what it's going to be named. But right now it's called the Allstate Benefits Broker Portal. I'm assuming the link name will change to Nationwide soon. When that does happen, an email will go out and make sure that you're aware. And before I actually open it up to questions, I do have one more slide that I'd like to bring up, and that is, it's actually a bonus slide. So the folks at Western Marketing held our feet to the fire and said, hey, we need to get a bonus campaign going here for our agents. And when we're doing that here, what we'd like to do is make sure that it is an agent-facing bonus, meaning it has no real concern to them. We are paying you, the agent. So in doing so, as of 5/1 effective dates of this year and later, and it's going to go for 12 months, so it'll go through 4/30. I should just say for 4/1 effective dates of 2026. This bonus program, if you have never written a case with us, we will write it, and you do write your first case, we will get you a $500 bonus just for writing your first case as a thank you. And again, I'm here to help write that case with you. So I want to make it as easy on you as I possibly can. Once you've achieved that first case, in order to achieve any of the other tiers, you are required to write two cases at least. It's very easy to write a $25,000 to $50,000 group plan on a very, very small group. I've written 3-person groups before that have been the equivalent of a $60,000 annualized premium. So it is very easy. If you write 2 groups, you should be approaching that $100,000 AIP mark, which is the annualized version of that premium. So what we do is we take the first month's premium. Let's just say it's $4,000. We multiply that puppy by 12. That's $48,000 of AIP. Okay, so we have to write 2 groups with the equivalent of $100,000 or greater in AIP, and you get a $1,000 bonus on top of that. If one of those 2 first cases was your first case of all time, you're getting a $1,500 bonus. And then for every tier you achieve after that, it's an additional amount that you see here. So for example, if you write $1 million, excuse me, let me rephrase that. If you write $2 million in AIP, you have a $27,000 bonus coming to you just for doing what you would normally otherwise do. If you write a $1.5 million or even just $1 million, you get a $15,500 bonus, assuming you wrote your first ever case. Now from that, I will open it up for questions.
Chris, do you have time to kind of touch on the traditional side that you guys are able to do, just what states you're able to do traditional?
Yeah, absolutely. So Missouri, Wisconsin, Florida, and Texas are, and also Indiana are all states that we have the ability to write the fully insured products in. Fully insured is not underwritten, so it is basically census driven, and the rates are the rates. And then what we would do is, if you send me over that opportunity and say, hey, we don't want to fill out applications, we just want the group health plan, you shoot that case over to me, I will get that census input, and I will send you over every single option that we have on the fully insured side for that group to pick from. We're utilizing in most of those states one narrow network and one broad network. The narrow network isn't always available everywhere, so for sure the broad network will be available. For example, in Texas, we are writing groups with the Cigna OAP network, Healthcare Highways network as the narrow network, and we're using Aetna as the broad network. In Florida, for example, we are using the Cigna Local Plus network as the narrow network.
Would you want to just kind of touch on basically the first step for these guys if they are interested in doing a group? Basically, what is the first step for these guys to just kind of get started? What do they need to do, and then what's next?
Yeah, so it's really easy stuff. It is simply the first step is getting a census from the group. When you're getting the census from the group, we'd love to know first and foremost if they do have a group health plan in place. We want a census of the group that's currently in force. Um, and the reason I say that is because we want to compare apples to apples as much as we can. If they are currently, if you send me a group that has 15 enrolled employees, but really only 5 are on the current group health plan, my rates for 15 enrolling employees are going to look wildly different from that of a 5 enrolling employee group. So I don't want, or I should say, it's not always wildly different. But the reason being is because we'd like to know who is likely to take the coverage and kind of put our focus on those 5 instead of the other 15, unless they are wanting to join. If they're truly interested in considering it, add them onto the census. That's fine. Very simple stuff. If they send us a full census of the whole group, that's fine too. Really, at the end of the day, I can show them rates regardless. And then when it comes time to underwriting, we can update our census based on who actually applies. So getting a census, if they have a current plan in place, I would love to know what kind of plan design they have, as well as what they are paying or what they're being renewed at. That just gives us a goal, something to aim for and try to beat. If I can beat it, I will beat it. If I can't beat it, I'm going to let you know. And we don't really want to waste a lot of time on that. I don't want to push you down a rabbit hole that's not going to get you anywhere. Your time is worth money. I want to respect your time. And if I can't get you into a competitive position, I'm going to tell you that it's time to walk away from it. And on our end, at least, you could of course look at other carriers still, but from my end, I will be very transparent with you and make sure that we're not wasting your time or the employer's time with an offer that can't improve their situation. After that, you get that census, you shoot that right over to me. I should have that thing turned around within about 3 business days. And then from there, we'll get the group together and talk to them about, hey, is this interesting to you? Do you like what you see? If it is, here's the next steps, which is then at that point in time, chasing down employee applications.
Perfect. Well, I'm not seeing any other questions here that I hadn't been able to just kind of answer one-on-one. So, I mean, if anyone has any questions, definitely please feel free to reach out to your marketer here at Western Marketing. Most of you should all have our number, but just in case, it's 800-852-7152. I'm going to go ahead and I'm going to send an email out after this is done and once I have the webinar uploaded and ready to go. So we do have this recorded, so you'll be able to watch back if you have any questions. But besides that, definitely feel free to reach out to your marketer here. Let us know if you do have a census that you'd like to get filled out. I did put a link in the chat option here with a blank census that you can have filled out. There's also a link in there to request this contract with us. So if these are something that you're interested in pursuing, definitely, feel free to use those links again. And I'll have all this on the email that I send out as well. And the big thing that we kind of want to push here is that, don't be afraid or nervous about moving into something that you're not normally selling. We understand that. We understand group might be something that you don't normally operate with. And that's what Chris and I are here for. We're here to help guide you through this situation, walk you through the whole process. If it comes down to presenting, Chris, like you said earlier in the webinar here, he's more than happy to hop on and do a presentation with you, and your client. Whatever you need, he's more than happy to do it. If Chris happens to be not available, both myself, Taylor, and Sandy Marrero here at Western, we are also very, very well versed in group at this point. We can also do stand-ins for Chris to help you get that presentation across with your client. One thing I do want to make sure to mention is Benefits wise, the way Allstate or now Nationwide works is there's never a time where we're not going to be at least able to match what they currently have. We should never have a time where we don't have a rich enough benefit. The nice thing with this plan is there's over 100,000 combinations that we can do on this plan. So we can always add more benefit in if that's something that they want. We can cut things out if that's something that they don't want. So that's just something, these are always discussions that we definitely want to encourage you to have with your clients. If it's something where they don't want this type of benefit, let us know. We can cut it out and it can affect the price. So it might be able to lower it down. So like I said, if there's any questions or anything, please feel free to reach out to us. And with that, thank you, Chris. I think we'll end it here.
I appreciate it. Thank you, everybody, for joining today. I do promise, this is one thing I will promise, is I will be better for you on any future calls, especially. I'm actually a little under the weather right now. So I know Taylor said this thing was recorded. Not my best work, but I appreciate you being on here, and everybody have a awesome 4th of July weekend.